Hello class, my name is Sherry Davis and I'm an instructor here at UMA. Today we're going to be discussing ICD-10 CM main terms and subterms. Feel free to get your ICD-10 CM coding manual out and follow along. The main term of a diagnosis, it best describes the reason chiefly responsible for the service provided. And this is the most important step when it comes to coding. If you have any symptoms present and they're documented, but a definitive diagnosis has not yet been determined, you want to code the symptoms. For outpatient cases, do not code conditions that are referred to as rule out, suspected, probable, or questionable. Diagnoses often are not established at the time of the initial encounter or visit and may require 2 or more visits to be established. So in this case, you only want to code what is documented and what is available in the chart. You also only want to code to the highest degree of certainty known at the time of the patient's visit. Therefore, with a rule out, suspected, probable, or questionable type of diagnosis, there's not a high degree of certainty, so that's why you would not code that. For inpatient medical records, uncertain diagnoses may be reported if it's documented at the time of discharge. You'll notice in the front of your ICD-10 CM coding manual is the alphabetic index. This is the area that lists all the conditions, and these can be expressed as nouns or eponyms with critical use of adjectives. When we're talking about eponyms, these are terms that are named after someone who has done the research or found the disease or condition. Like, for example, Parkinson's disease is an eponym. Crohn's disease is an eponym. So any time that there is a name associated, like a individual name associated, then that is an eponym because that is the researcher, doctor that first discovered that disease or illness. You'll also notice that some of the conditions known in the alphabetic index have multiple main entries. So you could find it basically under one of 2 or 3 places or more. And other general terms such as history, status post, or present of can be used to locate other factors influencing the diagnosis. So if you have a patient that has a history of an illness, you can go into the alphabetic index and go straight to history and find that in order to locate the diagnosis code that you're looking for. When we're talking about a main term, what we're talking about is what is the disease or what is the illness? What is the system that's being affected due to the illness or disease? So after you find this documented information, that's when you'll determine what the main term is. So the main term then can be a disease, an illness, or a symptom. You want to remove descriptive terms from diagnoses. If you look at the example we have here, we have acute bronchitis. Bronchitis is the illness, and acute is the descriptive term. Therefore, in the alphabetic index, you'll look under bronchitis. Let's take a moment and look at some other diagnoses and locate the main term in the alphabetic index. So if we had a patient with pelvic phlebitis following a molar pregnancy, we would take out the descriptive part of the diagnosis and look for the main term. In this case, if you're looking here, the diagnosis is pelvic phlebitis following molar pregnancy. Well, we don't need the molar pregnancy. Following wouldn't be our main term. Pelvic is the body area, so we would start looking under phlebitis. This is what we want to look right here. Once we get to phlebitis, that's when we want to look for pelvic. Now, let's move on to the next one, which is congenital coronary fistula. Once again, here's our descriptive term, congenital. Coronary is the location, so where we want to look at in the alphabetic index would be under fistula. From there, we would review the subterm coronary. So in our next example, we have ulcer with gangrene. Gangrene is the condition, and ulcer would be our main term because the ulcer is what is gangrene. So always start in the alphabetic index, and then you want to move on to the tabular list to double check each of the terms and make sure that you have the correct number of digits for your code. Let's take a moment and review some more main term examples. Our first main term here, we have diaper rash. Now, the diaper is basically what's causing the rash. So when we go to the alphabetic index, we're going to go to rash, and then we'll go to diaper. Okay? Now, we have a closed right forearm fracture, traumatic initial encounter. Now, right here it's telling us the body system. So what happened to this forearm? We have a fracture. Therefore, we will start in the index under fracture. We will then go to forearm and go from there. Next, we have nausea with vomiting. In this case, either one of these can be your main term. If you go to nausea, you'll see nausea with vomiting. If you go to vomiting, you will see vomiting with nausea. Our next example is post-surgical hypothyroidism. For this example, our post-surgical is basically descriptive of the hypothyroidism. So we will use hypothyroidism as our main term, and then we will reference post-surgical. Diabetes mellitus type 2. We will start with diabetes. We will then go to mellitus and then type 2. We're going to move on here and get further descriptive of each of these terms to review the subterms in the alphabetic index. When we talk about subterms, those are the terms that are listed underneath the main term in the alphabetic index. So what you want to do is, once you find that main term, you want to scan the subterms, which are sub-entries, and you want to be sure to review all the continued lines and additional subterms that may appear in the next column or the next page. What that means is, if you start on let's just take, for example, we'll start with the one term we just talked about, diaper rash. We're going to look at rash, and let's say that the rash starts in the first column on the bottom of your ICD-10-CM index. You will then see in the second column that it continues, rash continues. So what this is saying here, you always want to follow the columns and possibly to the next page. You'll also see shaded vertical guidelines in the index. That indicates the indentation level for each of the subterms in relationship to the main term. And default codes are listed next to the main term and represent the condition most commonly associated with that main term, or the other unspecified code for the main term. We're going to move on here with a few examples to show how the subterm looks in your alphabetic index, and what the default code looks like next to the main term. Let's go back in, like at the beginning when we were talking about acute bronchitis. If you go in your alphabetic index and go under bronchitis, you're going to see here, just like I talked in the last slide, see how this says continued? This is at the top. In this book, it's at the top of the second column. So bronchitis would have started in column 1, probably down here, and then went all the way down and is now continuing up to here. Okay, so in that example, it said acute bronchitis. So what we're going to do is we're going to follow this down, okay? It starts with tracheitis. Well, that's not what we need. And you come down further, keep following down, and you see acute or subacute. This here is telling us it's with bronchospasm or obstruction, and it's referring us to code J20.9. So what we would do next is we would go to the tabular list and look up J20.9. And then we would choose the code that is most specific to our diagnosis of the acute bronchitis. Let's refer back now to our example of the diaper rash. As you can see, we looked this up in the index under rash. Right here, it says toxic. That's the default, and the code is R21. But we don't want the toxic. We want the diaper, which is down 2. So here they're telling us that the diagnosis code we need to check in the tabular list is L22. At this point, we would then move to our tabular list, check L22, see if there's any other conventions or guidelines that go with it, or if it needs any more digits, and we would then choose our correct code from there. Our next example is our fracture of our forearm. Now, this here is in the index. We went under, first off, we went under fracture first, okay? And then after fracture, we followed all the way through the alphabetic list until we got to forearm. Okay, now they're telling us that we want to go check out code S52.9 in the tabular list. What this here is telling us, this check mark, is it's telling us that the tabular list, that this code here needs more digits or an alpha. Since it is a fracture, it does need an A, an S, or a D at the end. So it's referring us, it's telling us, go to that tabular because you have other digits or alphanumeric that belongs to this code. Now, if the patient only had a fractured radius or ulna, those are the two bones that are in the forearm, then they're telling us, okay, the radius, you want to look under fracture radius. The ulna, you want to look under fracture ulna. We only want the forearm fracture if both of these bones here are broken. Okay, so if both of these bones are not broken and one's individually broke, you would then refer in the alphabetic index to the correct area. Okay, so fractured radius or fractured ulna. Let's move on to the next example we had, which was the post-surgical hypothyroidism. I apologize for this print here. It's the only example that I could find. But what we're going to do here is, in our alphabetic index, we're going to go straight to hypothyroidism. Okay? The default is acquired, and they're telling us that's E03.9, but that's not what we want. We want post-surgical. So this one's a good example because it gives us all of the section of diagnosis is here. So we want to move down our list because we don't want these conditions. We want post-surgical, which is referring us to E89.0. So in this case, we went in the alphabetic index, we looked up hypothyroidism, we see the default is acquired, we know we don't need that because it was post-surgical. We then go down through and review all of the other diagnoses under hypothyroidism, and we come to the one that we want, which is post-surgical. As always, after you find your code, in this case E89.0, you want to go to the alphabetic index and you want to, you want to go to the tabular list. You want to check your code E89.0 and make sure that that is the code that reflects the highest level of specificity. Let's take a look here at our next example, which was diabetes mellitus type 2. You can see here, see where we're under diabetes, but it says right here, continued. Well, this diabetes started on the column before or the page before, okay? So we're following our guidelines here. We're following the codes. Now, once you go down, you'll first see the type here, and it's continued, but what we want is type 2, okay? Now, we have just diabetes mellitus type 2. We don't have anything else listed here, so what we want to do is we want to go to code E11.9 in the tabular list, and we want to check that to make sure that we are coding to the highest level of specificity. That means, do we have enough numeric digits, letters with this code? That is where you'll find the rest of the code if there's more to it. Let's look at our other example with nausea and vomiting, where, we discussed earlier that this can be found in either under nausea or under vomiting. If you turn to your alphabetic index, you'll see that nausea here without vomiting, they're referring us to R11.0. And then nausea with vomiting, they're referring us to R11.2. If we go in the alphabetic index under vomiting, it refers us to R11.10. But when we go to vomiting with nausea, once again, you see R11.2. Over here, R11.2. So either place that you look for certain codes, you might be able to find it in two different places. What you want to do here is, when you choose your code again, you go to the tabular section and you look up code R11.2 to make sure there's no coding conventions, notes, or if there's any more digits that need to be added to this code. So let's wrap up this video and discuss, what we learned today and the process of locating the main term, looking it up. So first you want to locate the main term in the alphabetic index. From there, you're going to scan the main term for instructional notations. And then you're going to identify terms that modify the main term in the diagnostic phrase. Follow any cross-reference notes. Verify the code in a tabular list. Follow all instructional notations, and at that point then, that is when you're going to select your code. Now, if you have any questions or anything regarding what we discussed today in this presentation, do not hesitate to reach out to your instructor and ask your questions or get clarification on something that you may not understand or have questions on. Good luck in your classes.